Hi, welcome. I'm Dr. Moore, Michigan Regenerative Specialist, and I want to go through with you what we do on a knee examination. First of all, we're going to watch you walk when we come back into the exam room to see if you're limping, if you're dragging the knee, if there is a problem with the way you're walking, and especially if you're grabbing your knee. And so we have Karen here, and Karen's going to be our example. So we're going to look at the knee, and we're just going to focus on the knee closest to the camera, which would be this knee. Karen, for example, says she has a problem with pain in this knee, so we're just going to do some light palpation and just feel for hot spots and tenderness, and then we're going to go a little deeper palpation and let me know if this bothers you at all. Go around, and then we're going to go to specific areas in the lateral edge of the knee, and then the medial edge of the medial portion of the knee with my thumb, and around the patella and fibula. Any of this bother you?
It's a little tender.
That's a little tender. So we're good at finding those spots, by the way. All right, and so that's what we're going to do. Palpation. We're going to do an observation, look for discoloration, look for swelling in the knee and the foot and the ankle, and then we're going to check and see the neurology to the knee, how well the knee is functioning. First, let's see how she feels in it. So we're going to look at the lateral femorocutaneous nerve, the femoral nerve, the obturator nerve, L2, which is up in here, so we're just going to hit the bottom of it, L3, L4 saphenous, L5 superficial peroneal, and the sural nerve. And so we're just going to do a side-to-side check. Does that feel the same as that?
I feel this side more.
Feel that more. So there's less sensation in this knee. Does that feel the same as that?
This side more.
So less sensation on the femoral nerve and the lateral femorocutaneous. Does that feel the same as that?
More over here.
More over here. So lateral femorocutaneous, femoral nerve, and the obturator really less sensation. So that would mean that the nerves to her knee are, there's less sensation and there's a dysfunction there. So we're going to look at L2.
Definitely feel it better.
Definitely feel more there. So less sensation in L2. L3.
That's the same.
That's the same. L4 saphenous nerve.
A little bit more
A
over
little
here.
bit more. So we have a problem with L4 saphenous nerve. L5 superficial peroneal.
More over here.
More over here. So we definitely see a discrepancy in the left leg. And then the S1 sural nerve.
Definitely more over here.
Definitely more over there. Wow. This is supposed to be my normal example. And we're also going to test reflexes, the patellar reflex and the Achilles reflex. Now the Achilles reflex you should have until you're 80 years old. And just real simple, just relax your leg. You can see that's a normal reflex. And that's a little bit more reflex. We hyper-reflexing on that one. We're going to test the Achilles on this one. You can see the reflex there. And there's definitely diminished reflex on this one. So we not only have a knee problem, we have a neurological issue on the whole left leg. So now we're going to do what we call two-point discrimination. We're just going to have Karen close her eyes. I'm going to touch her, and I want her to tell me how many places I'm touching her leg.
2.
2.
2.
And now we're up to L4,
2. 2.
L5.
2. 2.
And then we're going to do we're going to do digit span, so I'm going to ask you, I'm going to touch 2 toes. How many toes are between the 2 that I touch? Okay, so I'm going to touch 2 toes. How many toes between these 2 toes?
1.
1.
1.
1.
1.
1.
1. 1. Maybe 1.
Maybe 1. So she's not quite sure, so that means she's having a hard time interpreting things. And we're going to also test and see something called the agraphesthesia. How does your brain interpret what her feet are feeling? So I'm going to draw a number on your foot. Tell me what that number is.
7.
7. What number is that?
7.
Okay, very good. All right, so we've done a neurological exam. Now we're going to look and see how the nerves function. So I want you to lay your back. And just because of ease of me not having to get up and stand in front of the camera, we're going to do the right leg. So we're going to do a straight leg raiser. Tell me if this bothers you. Right there. So that's positive. We're going to come down a little bit. We're going to do a Bragger's test. Does that bother you? I don't want to do that. Okay, I want you to hold your leg up. It's called a Milgram's test. Does that bother you? And we're going to do a Patrick Degree. Does that bother you when you do that? So that's the general hip low back examination. Now we're going to actually test the knee. So we're going to do what we call McMurray's. I'm going to keep her knee bent, and I'm going to turn her foot out, and we're going to simply straighten the leg out. Tell me if this bothers you when I do that.
No.
Okay? I'm going to turn the foot in. Tell me if this bothers you when I do that.
No.
No, good. Okay? Now we're going to do a little adduction test. Does that bother when I do that?
No.
No? I want to do this. This is abduction.
Just a little thunder where your hand is.
Where my hand is. So we have 10 minutes in the medial portion of the joint. So we'll try just here, because I heard where my hand is here. Okay? And that heard it, should hurt it through here. Lateral collateral, medial collateral. Okay? We're going to do anterior and posterior drawer. I'm trying not to get in the way. Anterior drawer, posterior drawer test. And then we're going to look for glide on that. Okay? We're also going to test and see how well the brain is talking to the body. So we're going to test the rectus femoris in through here. I'm going to hold your leg up and through. I'm going to push. Very good. I'm going to test the tensor fasciae latae. I'm going to push in. Don't let me push in. Very good. I'm going to test the hamstrings. I'm going to push, pull out. Don't let me pull out. Very good there. I'm going to test adductors. I'm going to pull up, separate your legs. I'm going to separate them. Very good. So you passed all those tests there. That is our comprehensive knee examination. We're going to follow that through with some x-rays. And we're going to do a trial treatment on any one of those areas to see if can we get a functional response to see if care is going to work here. Okay? Thank you very much. I'm Dr. Robert Moore. I hope this was a big help as to what we do to clarify any questions or what we're going to do on your first visit if you have a knee problem. Thank you. Have an awesome day.